I'm Mary Ellen Carroll. I'm the Director of the Department of Emergency Management here in San Francisco. Thank you for being here. I just want to remind everyone about the priorities of San Francisco. Our priorities are to protect the health and safety of San Franciscans, and that is our most important responsibility. This is a constantly and rapidly changing situation, and we are working hard to be aggressive, to flatten the curve, to disrupt the spread of COVID-19 and protect community health. And finally, we call on all San Franciscans to do their part to help protect our most vulnerable residents by staying at home, practicing good hygiene, checking on people by phone if possible who might be isolated. What we are doing at our Emergency Operations Center is we are working closely with all of our city agencies, many who are represented here, to support the direction of the Department of Public Health. We are also supporting essential city services that need to remain open. This includes supporting essential personnel, making sure city services have the resources they need to maintain regular cleaning, and helping outside agencies understand how to implement social distancing. Finally, the EOC will continue to support efforts to shelter and care for people who are impacted by COVID-19 and vulnerable populations. Before we move on, again, I think the most important thing that we want to share with folks is that this is evolving, that we may not have all the answers to questions, but we want to hear those questions so that we can work those and turn those back out to folks, because we know there are a lot. At this point, I'm going to turn it over to my colleague, Director Jeffrey Tumlin from SFMTA.
Good evening. My name is Jeffrey Tumlin, Director of Transportation for San Francisco. As all of you know, public transportation is an essential government service. It is how our nurses and firefighters get to work, and it is how our residents get their groceries and prescription drugs. So we will be working hard to ensure that public transit continues throughout this public health emergency to ensure that people can get to work and get the services and supplies that they need. At Muni, we're working to rearrange services to decrease the amount of financial district express service in order to reallocate service to our neighborhood lines and to lines that serve our critical healthcare facilities so that our passengers can better maintain social distance while on the bus. For the health emergency, we will also be eliminating service on the cable cars and F and E lines in order to protect the health of our operators, ensuring that on all of the lines that we're operating, that our operators have a partition between their operating cabin and the rest of the transit vehicle. As you all know, Muni vehicles are thoroughly cleaned every night, and our stations are wiped down 4 times a day for areas that experience a high amount of touch. Our car cleaners have been phenomenally dedicated throughout this process and will continue to be so, and our operators continue to show up at work. In fact, today, despite the closure of schools, we had a higher than average attendance of our bus and rail operators. We'll be continuing to make announcements throughout as conditions change, and also working on changing some of our parking enforcement, tow, citation, and fee policies in order to accommodate the health emergency. We understand that many of our public will be affected by this emergency, and we are immediately suspending all late penalties for failure to pay citations, as well as stopping sending any late citations on to DMV or to collections. We're temporarily stopping enforcement of parking control measures that are not related to public health, safety, and accessibility. Effective immediately, we are suspending enforcement of residential parking permits, peak hour towaways, and parking for longer than 72 hours. We will, however, need to continue enforcement of rules related to public health, safety, and the accessibility of services. This includes street cleaning, blocking of bike lanes, double parking, and parking in transit-only lanes. Meters will continue to be enforced because our businesses will still be open, providing essential services for people and likely increasing the rate of driving to some of our neighborhood commercial districts. As you all know, this is a continually changing situation, and we urge you to go to sfmta.com for further updates. Thank you. And Bob Powers up next. And our next speaker is Bob Powers, General Manager of BART.
Good afternoon. How's everybody doing this afternoon? So Bob Powers, I'm the General Manager with BART. Just a couple of updates on BART. So first, BART is an essential service. You just heard from the Director for SFMTA about public transportation. BART is an essential service. And our workers, our frontline employees, stand ready to provide reliable mobility and to provide essential service to workers who are our first responders, who are providing health care services, who are providing social services, and for the folks who are working at grocery stores and institutions that need to be kept open in these trying times. So BART's ready to do that. We are providing regular service. Once again, BART will be providing regular service with long enough trains that will allow for social distancing. That's happening right now. We are disinfecting and doubling down on the cleaning to keep our riders and our frontline employees safe. Every night our cars are being cleaned, the trains are being wiped down. Routinely we're getting comments through the Twitter sphere about how well the stations are looking and what a nice job we're doing there. So BART police and employees who are essential to running service are going to continue to report to work. Others have been asked to work from home. If you're sick, BART is asking that you not ride BART. If your travel isn't essential, we're asking that you follow the order and not ride BART. And lastly, the trains must continue to run to ensure that the lifeline services for those workers who are going to keep our region functioning during these trying times is available for them to get to where they need to go. And with that, I will turn it over to the Director of Homeless Services, Mr. Kaczynski.
Good afternoon, Jeff Kaczynski. I'm the Director of the Department of Homelessness and Supportive Housing. Every night, our department and our nonprofit partners are providing shelter and housing to over 13,000 homeless and formerly homeless people. One of our top priorities is ensuring that the clients in that housing and shelter and our staff who are providing essential services are able to continue to operate in a safe environment. We're doing all that we can to ensure that those services continue and that the staff and the clients are kept safe. Our other priority is to ensure that we are educating people who are currently unsheltered, sleeping in the streets or in vehicles or in tents, to provide them with information about COVID-19, about social distancing. We've also provided over 20 hand washing stations throughout the city and are working to keep our shelters and other programs open as long as possible so people have access to basic hygiene. And lastly, we are very focused on preparing for what happens if there is an outbreak in a congregate setting or in our permanent supportive housing. We're working closely with the Department of Public Health and the Human Services Agency and DEM to plan for creating spaces for people who need to self-isolate or to be quarantined. And with that, I'll introduce my colleague Trent Rohr from the Human Services Agency.
Good evening, everyone. I'm Trent Rohr. I'm the Executive Director of the Human Services Agency. Our agency provides public assistance and services in the form of cash assistance, food and nutrition benefits, in-home care for seniors and disabled, meal services for seniors, as well as Medi-Cal benefits for over 250,000 San Franciscans. As of Friday, we have closed all of our public facilities, and these are facilities and sites where people would normally come to enroll in benefits, to seek access to services, to continue their benefits, or to get emergency assistance. We can handle most of our transactions through online portals and through the phone. We are open to the public in very limited circumstances that would require a face-to-face interaction, such as emergency housing assistance, emergency food assistance, a replacement of one's benefit card. And the way we're handling that is having greeters in front of all of our buildings who screen the individual and then walk that person in by him or herself. So we're taking all precautions we can in order to limit public contact with one another. On a typical day at the Human Services Agency, our multiple service lobbies have between 50 and 70 people in them waiting for services. Generally sitting side by side. We wanted to thin that out, and then as of Friday, I made the decision to completely close. The important thing to note is that while about 80% of our staff are going to be working telecommuting or working remotely, we are going to be able to provide 100% continuity of our services in terms of benefits and supports for San Francisco's lowest income populations. In addition, we are charged with child protective services and adult protective services. All of those protective service workers are continuing to work. They're working mobily. Our 24/7 abuse hotline for adults and for children are still in operation, and they're still staffed. And we still continue to do our emergency checks as well as our ongoing visits for children who may be in foster care. Lastly, in our in-home supportive services program, which is a vital program that provides in-home care for seniors and disabled adults to about 22,000 San Franciscans, those services will also continue. Should one of the clientele need assistance, the first order is a screen by the phone asking about that person's health. So if the person does need to be visited, we would have the proper safety equipment to place not only on our employee but on the individual. The Human Services Agency's second role in this situation is to provide for, arrange for shelter and care for the city. The city's emergency operations plans designate the Human Services Agency has this role. In the event of an earthquake, we would take this on. In the event of the virus, we are also taking on putting forth care and shelter for San Franciscans who are in the following population groups. The first population group would be individuals who need to self-quarantine because they were exposed to COVID, but their current living situation does not allow them to self-quarantine. So this would be people who may live in single-room occupancy hotels, either privately owned or operated by the city or our nonprofits, where there are congregate bathrooms, sometimes congregate kitchen and feeding facilities, and therefore they're unable to self-quarantine. Also in that population group would be individuals who are in our homeless shelter system, as well as homeless who are on the street. I'll give you an example. A homeless individual comes into the hospital, gets tested for COVID, after having shown the symptoms. A person who was housed would be likely sent home, told to self-quarantine. Hospitals will not release a homeless individual who can't self-quarantine. That's where our shelter and care slot would be activated for that person. As you know, it's very difficult to project the arc of the onset of this virus, and we're working very close with the epidemiologists at Department of Public Health to try to project. The estimate last week was that we would need about 3,500 of these housing units for those populations I just enumerated. About 2,500 of those would be for self-quarantine, and about 1,000 of those would be for isolation. Again, it's difficult to project the numbers. It's even more difficult to project the arc of infection. We're not going to need 3,500 units tomorrow. We might at the end, when the end comes, have needed 3,500, but we are slowly ramping up. As of the end of today, we have about 400 to 450 units that we are ready to activate should we need them. Thanks. I'm now turning it over to Joaquin Torres, who's the director of our Office of Economic and Workforce Development.
Thank you, Trent. Joaquin Torres, the director of the Office of Economic and Workforce Development. We have been very, very studiously, deeply engaged with our small business community and our business community here in San Francisco since the onset of the virus had taken hold. We have been working very, very closely with them and ensuring that all of the information has gotten out to the diversity of industries that are finding themselves and their employees impacted by the virus. We are encouraging everyone, employers, employees alike, to look onto our website at oewd.org and to click on COVID-19. That's oewd.org and click on COVID-19 so you can become aware about the resources that are currently available to you, whether you are an employer or an employee. Again, we want to highlight, especially for neighbors and those who are finding themselves thinking about where they're going to be shopping for some of their basic needs, to support your neighborhood businesses as you are able through the online services that are provided, in addition to the neighborhood grocery stores and other essential services that may have some of the things that you need all across this city. Again, we've instituted a small grant program of up to $10,000, resiliency funds. You can find more information on our website. We also are coordinating the resources in coordination with the SBA, the Small Business Administration, about the Disaster Relief Loan Program, which will provide up to $2 million in funds available at a 3.75% interest rate for those businesses, and please do visit our website for more of that information. In addition, as the mayor announced earlier this morning, for those employees that are in need of paid sick time, and once employer benefits and federal benefits have been exhausted, there will be a new program in place to allow for those employees working at those essential businesses here in San Francisco to avail themselves, and their employers to avail themselves of the program to ensure that they have the opportunity and the resources to continue to take that sick time and practice very healthy behaviors. So with that, we're looking forward to questions shortly. And who is up next? Mary, and please I'd like to invite up next our Sheriff, Paul Miyamoto.
Thank you, Trent. Paul Miyamoto, Sheriff here in San Francisco. I just wanted to reassure everybody in regards to the proclamation made by the mayor today, and in light of the stay-at-home and shelter-in-place health order that's coming out, our office is going to be postponing all of the evictions that we have scheduled and any upcoming evictions that may come out in regards to the civil process. In addition to that, all of our staff, as we have been preparing for weeks now, stand ready to support all of our public safety efforts in light of the most recent order and ensure a successful transition for the community into the new safeguards that we are placing on everybody in order to ensure that we reduce the potential spread of the COVID-19 virus. Thank you. And I believe next is going to be Deputy Chief Mike Redmond from the Police Department. Yeah. Oh, okay.
Thank you. So we'll take questions now. Go ahead.
You said you have 400 self-quarantine options available right now. What do those look like, and are any of them in use?
Thank you for the question. We have an urgent need today to activate 30 units, which we hope will come online by the end of today. We're finalizing lease negotiations for all of those units. We've done inspections. We're close to having them available. Right now, the need is only 30, so we feel prepared once the numbers start to tick up. Typical site would be a smaller tourist hotel that right now, of course, has a very low or no occupancy. These would be buildings in sort of Lower Nob Hill, edges of Union Square, 30, 50 units, 60 units, which allow, if needed, allow service providers to sort of be on site because of to address the health needs, rather than being in a large 1,000-person sort of setting with be more difficult to manage.
Can you explain what's going on? So does that mean 30 folks that are home?
I referenced in my remarks homeless individuals who come in to get tested at the hospitals. We don't want to take up valuable bed space in our hospitals for someone just awaiting a test. In this case, those are the 30 we're talking about. No. As I said earlier in my remarks, there's two populations largely that we're looking at, and these would be individuals who need to be quarantined but do not have a place where they can be quarantined. So a lot of them are actually housed. They would be living in facilities, single-room occupancy hotels, or other facilities where they're sharing bathrooms, congregate kitchens. They can't isolate in their room alone. So that's one population. The other population, of course, are the 2,000 or so residents of our homeless shelters and navigation centers who clearly can't self-quarantine either. In the example I just cited of the 30 that we need today, early tomorrow, those just happen to be homeless individuals who were tested in the hospital and were waiting results for their tests, and they're still in the hospital, and we would like to get them out to be able to quarantine so those valuable beds can be for folks who need them.
The governor said he wants to get every homeless person off the streets and sidewalks of California. How's that going to work in San
Currently,
Francisco?
the public health order, as you see, does not apply to the homeless. It encourages local governments to provide shelter for the homeless that are on the street. Right now, our priority as a city is to set up housing units for those who are either have been tested positive for COVID or who have been exposed and need to quarantine, and that is our priority right now. Within that prioritization, of course, are individuals who are homeless or who are in homeless shelters, and they will be provided a bed. We're currently assessing whether or not we would have the capacity to increase general shelter operations, expanding in other sites throughout the city. We have not finished that assessment or made that decision yet.
We have questions for some of our other department heads.
So at midnight, when this order takes effect, what will that look like? What will enforcement be like as far as getting folks to go inside?
So good evening, everybody. I'm Assistant Chief Mike Redmond with the San Francisco Police Department. Before I answer your question, I want to thank everyone up here for all their hard work over the last couple of weeks and especially the last couple of days. And just to let everyone know that days like this make me proud to be a San Francisco police officer because of the work that the cops and officers do on the street. I don't know how many calls, even from retired officers that are volunteering to come back to help the city. And I think this is when the city really shines, and we're going to shine. To answer your question, we have a very large deployment plan where we are going to use different bureaus and different officers that are assigned to different units throughout the department to supplement our patrol staffing, so we do not lose staffing within all our police districts in San Francisco. I think what you'll see is you're going to see a large deployment in certain areas where we would consider where shops are closed, officers in cars. You'll see those cars with their lights on, driving, especially when it gets dark. You're going to see officers on bicycles and officers on foot, especially in the daylight hours, but really a larger deployment than usual. And obviously, this is a very fluid situation that's going to change daily, but we'll be reevaluating every day sort of what we see and how we see the population grow in certain areas in San Francisco.
So these officers decide basically to protect businesses that are going to be closed?
Excuse me?
They're going to be there to protect the businesses which are closed?
No, so there will be officers deployed to certain retail areas, not just there to protect businesses, but for really a visible deployment and also a deterrent for any crimes to happen.
The order does say it's a misdemeanor to disobey the shelter in place. Is SFPD actually going to be citing people if they're out and they shouldn't be?
So I think this is going to be a very fluid situation until April 7th. The order does include an enforcement piece, but our main goal is not to go there. We do not want to go there. We have information in place for the officers if we have to. We will look at a supervisor response to anything like that, but there will be a lot of education and talking and things like that before there's any type of enforcement.
Any other questions? Jean?
For transportation folks, is there any contingency, any plan, are you preparing at all to close?
At this time, transportation is considered an essential service. We are making no plans to close. We need to get our hospital workforce to work.
You mentioned that as far as financial district services, that service is going to be cut, and those buses are going to move to the neighborhoods?
That's right. So as of the end of last week, community ridership was down about 30%. Those ridership losses were concentrated in the financial district job corps. Ridership has remained high in our neighborhood lines, serving neighborhood commercial districts and medical facilities. So what our objective is to rebalance the service based upon changing travel behavior in order to help our passengers maintain social distance.
On that note, can you talk about, as we've been talking about, at midnight when we're all sheltering in place, what does that look like for buses tomorrow for people who do need to get to their essential jobs?
That's right. So for Muni service, it is for the most part business as usual. Our workforce will continue showing up. they know that they're in service to the public. For our mechanics and car cleaners, they will continue to show up to work. For many of the rest of us who are also essential workers, we will be there in our offices supporting critical public service.
Back to the snow order and people are expected to stay at home. Now we obviously know that some people still have to go to work. They have essential jobs. Is that something that will be monitored on the trains or out in the streets? I mean, how are you going to take that approach?
So we provide transit service. We would need to collaborate with law enforcement if and when there is the need to screen why people are traveling.
Any other questions for our departments?
Yeah, today about ticketing and traffic enforcement. I wanted to get clarity on that. Does that start at midnight? If people were ticketed today because they were dealing with coronavirus-related stuff, those are still enforced?
So for tickets that were issued today, those will be enforced, but any late penalties on tickets issued today will be waived for the duration of the emergency.
Meters are going to be enforced and ticketed as far as parking enforcement officers?
So all enforcement related to public health and safety, as well as to the accessibility of services, will continue to be enforced. So health and safety would include double parking in a bike lane or blocking somebody's driveway. We also need to make sure that we're maintaining access to our commercial businesses, particularly for folks who would want to drive in order to take care of their grocery shopping or pick up their prescriptions. Street cleaning is considered currently a health and safety issue. We need to keep the streets clean in order to avoid other public health issues.
So you gotta still move your car?
Still move your car for street cleaning. That's our current guidance.
Question over here.
Yeah. Can anyone give me an idea of how many people have been tested for coronavirus and how many test results have come back and how many we're still waiting for?
Hello, I'm Dr. Susan Phillip. I'm a Deputy Health Officer with the San Francisco Department of Public Health and Director of Disease Prevention and Control. I know that everyone is very interested in the testing numbers. I will tell you that it has ramped up tremendously in the past several weeks because there have been very large commercial laboratories that have come online, along with other partners like UCSF, Kaiser, other hospital partners in San Francisco. So it's no longer just the public health lab doing the testing, which is how it started on March 2nd. I want to caution us from getting too worried about the exact numbers. For one, that number is changing and evolving over time and increasing as it should be. But really, the whole point of the orders and the discussion today is in combination with ramping up testing, which we need to do. We also need to really concretely, all of us, work on trying to decrease the numbers of people that have an infection and end up with a positive test. And just to bring us back to why we're doing this, all of this very disruptive impact on people's lives, it's because we are trying to preserve the capacity of our world-class health systems and medical providers here in San Francisco. They are among the best in the world. They do heroic work every day, including at San Francisco General Hospital, our level 1 trauma center. And we need to do heroic actions as citizens now to obey these orders, to shelter in place, to try and decrease the rate at which this virus is spreading in San Francisco so that we can preserve those essential emergency functions for people who really need it. And if and when this virus becomes more common in our population, we always know a small percentage of people will get really sick. We need those beds to be available. We need those isolation units to be available. We are fine right now. We can treat everyone who has an infection with COVID-19 who needs care. We want that to remain true throughout the next several months. So we really appreciate all the sacrifice, all the work that people are doing to make this happen, both within the city family and within San Francisco and all its citizens.
I know the numbers are going to change, but what have we tested so far and how many infections do we have so far in San Francisco?
So the San Francisco Department of Public Health is committed to every day updating the numbers of people that have infections that are San Francisco residents, and you can find that at the San Francisco Department of Public Health website. So that'll be updated every day at 10 o'clock, and it's 40 people today. Okay, but again, that number, we know that that number is what people want to think about, and we need to understand that the virus is here, and we all need to change our behavior dramatically so that we can keep that number low, and most importantly, keep the numbers of people who are critically ill in our hospitals low.
Last question.
Yes.
first responders and essential services workers, are they being offered tests right now, even if they're not symptomatic, seeing as we see that there are asymptomatic spread of COVID, and you have people providing services to all of us? Is that something that, is there a timeline for that, I guess is what I'm asking?
So our healthcare workers are a key focus. They're one of our 3 priorities within our department and within our Emergency Operations Center, protecting our healthcare workforce, both because they are on the front lines and because that capacity is part of our capacity for taking care of very sick people. And so they are a priority and are being evaluated, interviewed, tested when there's a concern that they have been exposed to a case of COVID-19.
Police officer or firefighter can go in and say, I'd like a test at this moment.
We evaluate all of those requests, so we work with people. So we are prioritizing the people that are on the front lines. We are talking with people. We're having them talk to their provider. If they are in a setting where we know they have been exposed to someone who is a patient with COVID-19, we are prioritizing those folks for testing, for sure.
Is there anyone who can answer a question about the grocery stores and the issues there? One in our neighborhood was only open from 10 to 2 today. There were lines around the block. Anyone who, because that's a major concern for most people.
We're having conversations with individual grocery store proprietors as we speak, and checking on providing more up-to-date information about what the hours are. We understand that some folks are actually changing the times in which they are providing services, so we'll be answering further questions on that. Again, as a reminder, there are an assortment of neighborhood grocery stores all around the city that have so many of your amenities, and please do take the time as part of these essential services that you need to patronize those places as well. We will be providing some updates and sending some tweets out at our OEWD website to make sure that people have that information as well, and we do encourage others just to take use of that time on social media about opportunities of supporting your local businesses, your communities, and your neighborhoods. Thanks.
Okay, we're all set. We have a media advisory that comes out at 10 a.m. every day. Thank you.